We have to link payment with tools. I guess a couple questions here. I mean, does the payment sort of create the incentive to develop tools? Do we need to have the tools before we change the payment?
No.
And, you know.
You need to do both at the same time. I mean, that's the reality. Other industries figured out this stuff a very long time ago. You know, I'm sure that car manufacturers have figured out how to bring all the pieces together and sell it in the open market, and if their product is not high quality, then they can't sell it and they lose money. So I think to Peggy's earlier point, there has to be downside risk for, and it needs to be implemented immediately. I think bundled payments, every other industry has figured out some way or another how to bundle services and offer the consumer one price. We got to do that in healthcare. Yes, it's incredibly difficult. It's got to be done. And I know we're certainly moving in that direction very, very slowly, but we are moving there. But I do think that whatever we call it, and we have a lot of acronyms and names for these things, basically we do need to really push the healthcare system away from fee-for-service. It's not a gentle nudge. It is a push, because this is I think it's the way to get the attention of providers is when it's clear to them that the incentives are obvious and that they can lose if they don't start to play ball with this new
And then
way.
all of a sudden you create new industries as well. There are so many entrepreneurs out there
Yes,
solving
that's true.
health data problems and so forth. So, you know, it may be awkward in the short term in the transition, as it always is when you make big changes. But I think we've got to be determined to go towards this. And I'm very impressed with what's happened with MACRA. I'm impressed with the commitment of the Secretary to value-based payment and so forth. So I think that the will is there. You know, there's going to be a lot of political pushback, and whether we'll get there, I don't know. But I feel like for once, you know, there seems to be a determination to move towards this value-based payment.
And there needs to be accountability and transparency also.
Yes,
That's
absolutely.
critically important. Otherwise, we could go in the wrong direction and not even know
Absolutely.
it. So I think that piece and it's something CMS has taken a lot of leadership on, but we need to ensure that that's incorporated.
Yeah.
So I think the ultimate question will be, what's the best way to take a lot of these, because individual state Medicaid programs are doing a lot of things. The SIM grants at CMMI are doing a lot of things. Medicare is doing a variety of things. What's going to be the best vehicle to take all of these different things and say, are we going to pick one, or are we going to pick five, or are we going to pick a theme, and translate that? Is it going to be Medicare? Is it going to be Medicare saying, well, we're one program, we're in all 50 states, we're just going to do X?
No, I don't think so. I don't think so.
But we have to figure out. Otherwise, it's just, again, it's the individual flowers popping up, and how do you?
It's not 1,000 flowers, but it might be 10.
Right.
Well, even if you take one
How do you go to
concept,
scale?
like
Yeah.
PCMH, I mean, in the past year or so, there's been conflicting studies, right, from the same state on the value of the patient-centered medical home. So a question is,
Time 1 and time 2.
yeah, or what's a delivery system to make of this? The PCMH model sounds simple, but there's a lot of heterogeneity when we think about sort of the way in
Well,
which that's
especially
rolled
when
out.
people are out there spawning all kinds of things called PCMHs that aren't. Not that I'm bitter.
Yeah. Other innovative payment models. We talked about bundled payment, and Austin, you referred to CalPERS a little while ago. Were you talking about the hip and knee reference price payments?
Yeah, they're doing it for a number of things now. Hip and knee is where they started doing colonoscopies. They're doing other surgical procedures, and what they're doing is finding providers with adequate quality and looking at the prices of those and pegging a price, say, for a knee replacement to that price where this provider or this set of providers can provide it, making sure their policyholders have access to enough of those, but also saying you can go anywhere you like, and we're only paying this price, but if you go somewhere that costs more, maybe you like it, maybe it's more convenient, or maybe you think the quality is worth it, you have to pay for that out of pocket. And they've found that's yielded a tremendous price reduction, changes in the market. I think on the order of 20-30% in some areas. So it's been successful for CalPERS. There's also been some pushback by others about to the extent to which it can be generalized, particularly to other kinds of populations who maybe can't shop around as easily. What you need are, you can't do this in markets where you don't have enough providers to have the variety, so people can make these kind of decisions. You can't do it in places where you don't have the transparency on price and quality. So there are limitations, but at least for CalPERS, it's been fairly successful.
Another model that's really interesting is what Walmart's done, which is, and some other large employers have done this as well, but they've really been leaders. They picked 6 health systems that they believe are extremely high quality, team-based medicine, and they have said that for spinal surgery, their employees can go to one of these 6 facilities. They will waive all co-pays. They'll pay for 2 people to go out with them, et cetera, and they can get a second opinion, and if they want, they can get the treatment there. They have found that this has been very successful, great, vast improvements in quality, but also to their surprise, there were a lot of procedures that were recommended in communities that Cleveland Clinic or Mayo said, nope, they don't need that.
Right.
And so the overuse issue has become something now that is very much front and center for a lot of large employers as a result of the Walmart experience.